Good afternoon, everyone. I'm Gary Nelson, President of the Healthcare Georgia Foundation, and I think I was asked to come up and just give you a quick 5-minute update, no PowerPoints, no slides, update on an activity that's going on in the state that actually has something to do with rural hospital sustainability. And it's what the foundation, Healthcare Georgia Foundation, has been doing these last 4 years. And that is a focus on the rural community. Just as there are distressed hospitals, there are distressed rural communities. And the foundation has discovered that through a process of due diligence research and looking at data, much like Nikki described earlier, as a matter of fact. I think most of you may know the foundation, knowing many of you in this room. Healthcare Georgia Foundation, by the way, is a statewide private independent foundation created back in 1999. Result of Blue Cross Blue Shield conversion. We're a completely separate, independent foundation, but we're funding now in rural health with an initiative called the True Georgia Initiative. We do about $5 million a year in grant making, to date around $68 million in grants to nonprofits throughout the state. And the work that we've just launched recently is all about you and the communities that you're working in. And I'll take 2 minutes and just give you a quick update. Hope that this opportunity comes up again so that we can share with you the progress that we're making and our investments in rural communities. As I said, we spent a lot of time studying the rural landscape in Georgia. And soon after we started, we discovered the concept of the two Georgias. We've embraced that as our concept, describing the significant disparities in health and healthcare that exist between urban and rural climate, rural and urban environments in our state. And those disparities continue not only in terms of healthcare, but social disparities as well. And we've looked at the healthcare workforce, we've looked at OASIS data, all the medical CMS data, all to help us better understand what the needs and opportunities were. I think the one thing, yes, there clearly are rural spots and segments, and even in urban counties, but the rural counties in our state are clearly without a number of social assets or social capital, which we think will help sustain rural hospitals. And so we launched the True Georgia Initiative. It was officially launched in June of this year, and we funded 11 collaboratives or partnerships that represent more than 11 counties, actually. Of the 159 counties, at least when we started, there were 109 rural counties. And they were all eligible to apply for our funding, and we ended up through a competitive process selecting 11 of them to work with, and I'll share the names of those in just a second. But those 11 communities are partnerships that are working in either a specific town, multiple towns, a county, or even multiple counties in rural Georgia. And it's all about better health and health, getting the right care at the right time by the right provider. It's about improving and addressing health disparities, improving health equity. It's about addressing what we believe to be one of the underlying determinants of health, the social determinants of health. But if we don't address them, we will underachieve and underperform as a state or as a county. So just to give you a heads up, the 11 counties received funding in June for about $70,000, and they will, this year, be charged with two things. One, developing a health partnership. Much like Tim described, I would say the partnerships are working on their internal governance and transparency and management, if you will. And as Tammy described, they are to develop a health improvement plan, but the health improvement plan will focus not on an organization, but on the community. And they will be delivering those to the foundation in March of this coming year. And what's exciting about that is we will then begin a 5-year engagement with each of those counties with funds of about $100,000 or more per year going to each of those 11 areas. Also, on top of that, something the foundation has never done before, and we're eager to try it out. I mentioned it to a couple of you earlier this morning, and that is not only do we do grant making. As a foundation, we're required to pay out about 5% a year. But we're investigating and seriously pursuing the opportunity to do low-interest loans. And those low-interest loans might find their way to you, your community, and the institutions, healthcare institutions in in those counties. But let me conclude by just identifying the 11 counties and see if there are any quick questions so that you can get back on track with your agenda. The counties that we're funding are Appling, Chattooga, Lumpkin, Cook, Elbert, Early, Decatur, Hancock, Haralson, Miller, and Clay. As I said, they will be delivering health improvement plans this year with fully developed health partnerships, and then work with us over the next 5 years or more in the implementation of these health improvement plans. Some of them are dealing with health and healthcare. Some are dealing with hospitals. Others have discovered behavioral health and mental health issues, telehealth. Others are trying to co-locate services around affordable housing, if you will, transportation, and other kinds of things. So we're looking forward to the engagement and the work with these partnerships, and I'm happy to answer any quick questions. If not, thank you for the time. And again, I want to congratulate and thank Augusta University and the Center for Rural Health.